Welcome to the press briefing today. With us are Dr. Albert Au, Principal Medical and Health Officer, Communicable Disease Branch, Antiviral Protection, and Dr. Larry Lee, Chief Manager, Hospital Authority. First, Dr. Au will update us on the cases. Citizens of Hong Kong, media friends, good afternoon. I'm going to report on the cases received by CHB yesterday, the 21st of March. Yesterday, we had 4,296 PCR positive cases. Case number 696,113 to 600,908. And we had 9,856 RAT positive cases. The two add up to 14,152 cases. Up to now, in the fifth wave, we had a total of 1.063279 million cases, and of which 688,000 are PCR positive cases, and 370,008 cases are RAT positive cases. And among the 4,296 PCR positive cases yesterday, 940 were confirmed by HA and 333 by public health lab services, and 3,023 cases confirmed by private laboratories. And yesterday, the public health lab has conducted genome testing and on 744 samples. We have not detected any L452R cases. And 406 cases tested negative for L452R, and 388 cases have results pending, and they carry a low viral load. And 10 cases are imported cases. Yesterday, 3 are arrivals from on the 25th of March, flyer TK806, and then 4 on, and 3 are arrivals via TX796, and 1 are from TK03A3 and on the 19th. And the last case is EN205 from Vietnam on residential care homes. There are 2 additional residential care homes for the elderly which have reported infections, and there are only 2 cases. No staff member has been affected, and we have not recorded any additional RCHD which has reported infections. Up to now, in the 5th wave, a total of 780 RCHEs have been affected, and in the past 2 weeks, and 91 RCHEs have seen outbreaks and infections, taking up 11% of all RCHEs in Hong Kong. And in the past 2 weeks, 2,116 residents and 473 staff members have been involved. In the 5th wave, some 34,000 residents have been affected, taking up 45% of all residents of RCHEs. And 8,258 staff members have been affected, taking up 29% of all staff members. In RCHDs, up to now, 282 RCHDs have been affected, and in the past 2 weeks, we have an additional 53 RCHDs affected, taking up 15.8% of all RCHDs in Hong Kong. In the past 2 weeks, we had 870 residents and 337 staff members affected. In the 5th wave, for RCHDs, 8,840 residents have been affected, taking up 48%, and 3,186 staff members have been affected, taking up 30% of all staff members. In terms of death cases involving those at residential care homes total 3,370 cases. The overall death rate in Hong Kong in the fifth wave, we have 6,151 death cases. The death rate has risen to 0.58%. Yesterday, we had an additional 245 death cases. 8 of them were outside of the hospitals, and they were reported by DH's forensic pathologists. For these 6,151 cases, some 3,000 males and 2,000 females have been affected, and they're aged 11 to 112, and the median age is 84 age, and then 6 children are affected. 247 cases involve adults from 18 to 59 years of age, taking up 4% of all death cases. For the remaining 5,888 cases involve elderly aged over 60, taking up 59.7%. There are 4,355, and they take up 78%. And there are also 8 cases reported by public mortuaries involving 6 females and 2 males, and they are aged 56 to 92. One of the cases was discovered on the 18th of March, and 4 cases discovered on the 10th, and 4 cases on the 11th. Of these 8 cases, 1 involved resident from RCHD. 1 involves a 56-year-old female. The others are all aged over 70. For the 56-year-old female, she had chronic diseases, and she was not vaccinated. In the analysis of vaccination, the CHB has conducted an analysis on the vaccination of the death cases. Up to now, we found that 88% of the death cases are not vaccinated or not fully vaccinated. And for those aged over 80, over 90% were unvaccinated or took only 1 jab. In terms of death rate, for those unvaccinated or those who had 1 jab, the death rate is 1.64% compared to those who had 2 jabs or more, which is 0.1%. There is a difference of 16 times. With those aged over 80, those who were unvaccinated or had 1 jab, the death rate is 11.1% compared to those who had 2 jabs, which is 2.9%. There is a difference of 4 times. So much for my report. Now we'll defer to Dr. Lee to update us on the HA situation. Right now, 11,646 patients were staying in public hospitals, North Lantau Hospital Infection Control Center, HA Infectious Disease Centers, and AWE Community Treatment Facilities. Yesterday, we have received reports of 41 patients in critical conditions. 25 of them have no vaccination record, 82 are in serious conditions, and a total of 114 patients in critical conditions are staying in the ICU. As of midnight today, in the past 24 hours, 190 COVID-positive patients passed away, 105 male and 80 female, aged 42 to 107. For those who have passed away, 104 came from residential care homes, 111 have no vaccination records, and 46 had 1 jab, 31 2 jabs, and 2 3 jabs. And of these patients, 176 are aged over 65. And there are 5 relatively younger patients who have passed away. Let me highlight them. There is a 42-year-old male. He had 3 jabs, and he had serious heart diseases, and he had some transplants as well. And he had fever starting from early March, and he tested positive. On the 20th of March, he went to Port Oi Hospital A&E department in the morning. He had fever, shortness of breath, and he was admitted to hospital. And that night, he felt unconscious, and after resuscitation, he passed away on midnight 17 on the 21st of March. 54-year-old male. He didn't have any vaccination record. He had cancer, and he has hemorrhage on the brain. And on the 6th of March afternoon, he went to United Christian Hospital in an E department, and he tested RAT positive. He had shortness of breath, fever. X-ray showed that he had pneumonia. He was admitted to hospital, and his condition deteriorated. On the afternoon of 21st of March, he passed away. The third one is a 55-year-old male. He had 2 jabs, and the last one was in November last year. He had hypertension and diabetes. And towards the end of February, he tested RAT positive. And on the 8th of March, he went to the A&E department of Princess Margaret Hospital for abdominal pain and so on. And X-ray showed that he had pneumonia. He was admitted to hospital later on. And he had unstable blood sugar level, and he had some renal disorders. And on the 15th of March, his saliva sample showed a CT value of 30. He was transferred to the rehabilitation building in Lai King. And then on the 21st of March, he was unconscious. We had resuscitation on him, and he passed away in the afternoon.
The fourth case, 56-year-old female. She had 2 jabs, and she was disabled and lived in the care homes. And on the 6th of March, she entered Princess Margaret Hospital, and she had fever. She had low blood pressure, and pneumonia was found. And we gave her medication, and then her situation stabilized. Then she was transferred to the North Lantau Hospital Infection Control Center, and then her condition deteriorated. Starting from the 11th of March, she had to put on the machine and for breathing, and then she passed away. And then the last case, 60-year-old female, she had 1 jab, and she also lived in care homes. She suffered from high blood pressure and also had diabetes. She went to Chinmen Hospital, the A&E department, on the 20th of March, and then she was tested positive from antigen test. She had pneumonia as well. And then after being admitted into the hospital, we gave her medication, and also her condition deteriorated, and on the 21st of March, she passed away. And I'd like to report on the condition from 7th to 20th of March, including the 8-year-old girl. We've reported her case. So the remaining 47 death cases include the 17 male and the age 22, 102. And in the past day, we have 1,236 patients discharged. About 20 patients were screened positive, and then about 30 patients were regarded as close contacts. And for staff, there are 19,922 staff who were tested positive, and about 14,068 staff have resumed duties. This is the question time. Please raise your hand and use the microphone to ask your questions. Also introduce the media companies that you represent. The first one, over there, please. Hello, I'm from ... News. First question, Professor Sophia Chan mentioned that the Leave Home Safe app will be resumed, and there will be compulsory testing orders issued. We understand that there are quite a lot of people who have already been infected. If the compulsory testing order are going to be issued, there might be a surge of infected cases. Does Hong Kong have the required capacity to meet the requirements for testing? And also for the PCR test, what is the capacity for testing each day? And also regarding the RTD operations, the government asked that people who stay in the premises for more than 2 hours have to be tested. However, there might be people who entered those premises, especially the public housing, that do not need to use the Leave Home Safe app. So under this kind of RTD operation, if there are people who have not undergone testing, and also there might be people who do not open the doors, what would the government do? Thank you for your question. Your first question about compulsory testing. Yesterday, the chief executive, together with the secretary for food and health, mentioned that the compulsory testing order will be issued again. Well, this is to control the risk, and through the present analysis, we like to find out if there are any groups or any premises, for instance, residential areas that are high risk. So through the information we collect from the two platforms, first is the RAT declaration platform, and another platform. Through these, the data collected from these two platforms, we will try to see what are the high-risk premises. If the premises have to undergo compulsory testing, then the government will, through the Live Home Safe app, issue this notice to the people living there or people who have entered those premises for more than 2 years. They will receive this information, the compulsory testing information. Later on, the government will have further notice on this, and we will also have a daily announcement. In the community testing centers, every day the testing capacity is about 100,000 to 120,000. So we do have the necessary capacity. Well, it all depends on whether there will be a surge of people who have to go through compulsory testing in the future. We will closely monitor the situation, and in order to make sure that we can conduct testing on the most high-risk areas and premises. Regarding the second question, RTD operation, it is also risk-based. If a premises is regarded as a high-risk premises and have to go through RTD, then people who have entered those premises and have stayed for more than 2 hours may have exposed to the virus. So they have to undergo testing. So under these RTD operation, government staff will go through all the units, and there will be follow-ups if if some premises do not open their door, and there will be enforcement actions. Next question, please. I'm from TVB. We see that the confirmed cases, the number have dropped in the past 2 days, but then the death rates have increased. I'd like to know whether there are any correlation between the two. And as mentioned, that the compulsory testing orders will be reissued soon. Do you expect a surge of cases in the coming days? And also about the distribution of the oral drugs. Is it that people over the age of 60 will be eligible to receive these antiviral pills? And I'd like to know the distribution status of the drugs, and can there be kind of more flexible measures so that private hospitals can also help in distributing the oral drugs? Well, this morning, as mentioned, the Hong Kong U Medical Faculty report states that if we are to ease the measures, the antivirus measures, then it has to depend on the capacity of public hospitals. So if the measures are released, then do you think the hospitals, public hospitals, have the necessary capacity to cope with possibly increased cases? Thank you.
Let me first respond to the first two questions. Indeed, in the past few days, we have seen that the trend is such that around there will be 15,000 to 20,000 cases every day. That's the case for the past several days. But of course, the figure fluctuates from day to day. And compared to the figure last week or earlier times, indeed, the number has dropped a bit. But like what the chief executive said yesterday, we are seeing 15,000 cases per day compared to the third and fourth waves, where the peak number was a little bit low. We are 100 times over. So we are seeing still a high level of infections, and we have not seen significant drops. And it's still stay at a higher level. The overall figures seems to be lower than that in early March, and the death case numbers are lagging behind always. While patients may be admitted to hospital, then their condition may deteriorate. So from the day of the infection to the day of passing away, there may be a period of 1 to 2 weeks. So the death rates that we are seeing today reflects, say, the infection numbers a week or two ago. So that explains why the death rate is still hovering at a high level. The second question is about compulsory testing notice, whether it will cause a rebound of the epidemic. The aim of CTN is to ask those who have visited high-risk premises or high-risk groups to take a test as soon as possible. So the purpose is to identify the cases as early as possible so that we can implement the relevant public health measures. Now, if people are willing to do tests, and then the test quantity is large, then CTN is just but a support measure to help us to identify as many cases as possible. Now, if the case number increases after we have restarted CTN, then we are actually achieving our purpose. We issue the CTNs because we want people who have been to high-risk premises be tested, and we can identify them as early as possible. Whether the epidemic will rebound depends on a number of factors, whether Hong Kong people observe social distancing measures and the vaccination rate, etc. Dr. Lee, you mentioned about the oral drugs. Right now, we have prescribed more to the patients, and we have revised the clinical guidelines, and we are prescribing them to those aged over 60 for people who have or have not completed the full vaccination. So we recommend the oral drugs to these people as long as there are no contraindications. Now, for those under 60, whether we will look at whether they are high-risk groups or whether they have taken any vaccines. So as a result, more patients will be using such oral drugs. There are different channels whereby the drugs will be prescribed. We are doing it in an all-round manner, including patients in public hospitals, and we also prescribe them to those patients in the designated clinics. And you may understand that whether in AWECTF or various community isolation facilities, we will also prescribe such oral medicines to the right patients. So we are doing it in all manners and ways. Now, as for private hospitals, well, we have also offered them some oral drugs, and their clinical guidelines will be the same as those of the HA. Now, talking about the capacity of public hospitals, we cannot just look at one figure. We are now having a triage system, multi-tier treatment approach. Now, apart from the traditional pillar of public hospitals, you also have a lot of CTFs and CIFs. And for CIFs, some of them are dedicated for the elderly patients. Now we are having a collaborating treatment model together with the mainland medical staff in our CTF. And the number of patients that we can handle has increased. So compared to the past, our capability has been boosted. And many of our beds, hospital beds, have been turned to COVID dedicated beds. Well, what matters more is we have to reduce severe cases, the numbers aside. So I hope that the Hong Kong public can work together with us. You should take the vaccines, especially the elderly. Then that can help us. Next one. The journalist at the very back row. I'm from cable TV. Well, in the past few days, the number of cases has been coming down. And Professor Sophia Chen said that this week, the CTN function on Leave Home Safe will be reactivated. So at what level will the case number have to be before the CHB restart your contact tracing work? Now, you're also revising the guidelines for oral drugs. Now, what is the quantity of the two types of oral drugs prescribed so far? Professor Gabriel Leung also suggested that the DH can provide certain information to the HA to identify high-risk groups, and then the medicine can also be delivered to the homes of the patient so that those who need the medicine can really get them. So will the HA consider this recommendation? Will there be difficulties in deploying the manpower to do that? Thank you. In response to your first question, CTN, the Food and Health Bureau has earlier announced that in a short time, CTNs will again be issued. And this is because that we do have the PCR test capacity to do more. Since we have the resources, then we should test as many people as possible and hopefully to identify more cases and cut the transmission chain within the community and stabilize the epidemic. Now, the CHP has been collecting epidemiological information of the cases through the RAT platform and also the CDPI platform, including the patient's occupation, their work office address, their home addresses, and the family members' information, and so on. So through information collected online, we would do analysis. And if we find that there are a lot of cases in a certain building, then that building will be subject to CTN. And then we would also disseminate the relevant alerts through Leave Home Safe to the relevant residents. Now, because there are so many cases recently, so we've been concentrating our efforts on tracing the close contacts, i.e. the household members of the patients. And we also arrange for the close contacts to be on home isolation. And if necessary, we will arrange for them to be housed in CIF. And if the number comes down, we would enhance our online platform to collect more epidemiological information on the web so that we can carry out more in-depth analysis so that we can do more contact tracing. Now, then other close contacts may have to be quarantined as well.
Regarding the oral drugs, as of 21st of March, for Molnupiravir, we have prescribed 16,800. For Paxlovid, we have prescribed 2,358 doses. The numbers are rising. As regard the advice of Dr. Gabriel Leung, we will take into consideration the views of different experts. Well, we have to take into consideration the interface between the CHP and HD, and there are also some issues that we have to overcome first. Of course, for the general direction, we hope to be able to cover as many patients as possible. Thank you. Next, please. I'm from Ningpo. I'd like to ask about the suggestions provided by Dr. Gabriel Leung. Well, the Hong Kong U in research states that we have to perhaps accept the fact that the virus will one day become an endemic disease for Hong Kong. Do you think that this is the right moment for us to accept it as an endemic disease? And if there are people who have the first jab with Sinovac and the second with BioNTech, is the government prepared to provide this kind of opportunities for people to receive BioNTech vaccinations? Next, about death rates. You just mentioned about the 5 death cases who are relatively young. I'd like to ask if all of them died of COVID. And for the death cases, I'd like to know how many cases died of COVID and how many died with COVID. You also mentioned about a death case of a patient who had 3 jabs, and I'd like to know when was the time that he had the patient had the 3rd jab. And about the oral drugs with updated clinical guidelines, how many patients will be benefited? You also mentioned that the private hospitals also have the oral drugs. I'd like to know how many have been given to the private hospitals and how many to the residential care homes. Let me first answer your first 2 questions. First, about the Hong Kong U research. I'm sure that they have these research are based on scientific method and also the epidemiological data that they have collected. But then it is difficult for us to have very accurate projection or analysis of the future development of the virus. All we know that is the case levels are still pretty high, and it is too early for us to say for sure how the situation will turn out. Of course, our target is to try to make the case numbers drop, and we hope that through social distancing measures, we'll be able to cut the transmission chain as soon as possible, and also we would encourage members of the public to go through testing, and we hope to be able to identify confirmed cases as soon as possible, and that is to reduce the death rate. Well, again, we are still adopting the dynamic zeroing policy. We will closely monitor the development situation of the virus. And also, it is not impossible that the case will rebound. And because we have seen that in the past waves, and in 2021 January, we witnessed a rebound. So we understand that we have to be vigilant all the time and shouldn't let our guard down. Regarding vaccination, it is very clear that from the data collected, whether patients received the Sinovac or BioNTech vaccination, it will greatly reduce serious cases and deaths. As I've also reported to you about the death numbers. For Sinovac and also BioNTech, a person having 2 jabs or more compared with people with 1 jab or no vaccination at all, these conditions, you can really see a very clear difference, especially for the death rate is also 4 or 5 times higher for those who have not been vaccinated or only vaccinated with 1 jab. So Our conclusion is that for both BioNTech and also Sinovac vaccination, it will greatly help reduce severe cases and deaths. So for people who have received 2 Sinovac doses, they could choose to receive the third jab in BioNTech. But of course, we would respect the wish of the person, and they have the choice to choose between either one. Regarding the antiviral oral drugs, well, I don't have the data at hand. That is how many doses have been prescribed or have been given to the private hospitals. But I can tell you that in the past few days, we have increased the number of the drugs given to the private hospitals. Regarding the death cases of people who of a relatively young age, we will later on have this number. Well, I think for the 42-year-old male and the 50-year-old male, I would think that the deaths may not be directly related to COVID. I don't have this number at hand right now. Next, please.
CMP News, a few English questions. So, Sophia Chan earlier said that the compulsory testing orders will again be reissued through the Leave Home Safe app. May I ask if there's any timeline on resuming when these notifications will be issued, and whether you are optimistic that authorities can start to narrow down or trace down the sources of outbreak soon? And how will manpower and resources be redeployed back for contact tracing? And secondly, currently recovered COVID patients are exempted from compulsory testing during the RDT. So the CE mentioned on Monday that such persons could still test positive, but then their viral loads are low and their transmission rates are low. So will a similar exemption for pre-departure and on-arrival PCR testing be extended to inbound travelers who have recently recovered from COVID? And my last question is, regarding any of the children deaths so far, are there any coroner updates? Thank you.
Thank you for your question. For the first question on compulsory testing notice, as the Chief Executive and the Secretary for Food and Health has announced yesterday that the government will resume issuing compulsory testing notice very soon. And the government will depend on the risk assessment as well as the epidemiological information collected from the cases to determine the high-risk group or high-risk venues which justify compulsory testing. And I think the Food and Health Bureau will soon issue the details about the compulsory testing notice. And for the contact tracing, currently the Center for Health Protection rely on the electronic platform for the positive cases, including those tested positive through the rapid antigen test or PCR to report their information, including their residential addresses, workplaces, etc., to the Center for Health Protection for our epidemiological analysis. And we will analyze those informations to identify high-risk areas, including high-risk residential buildings where there were more cases for recommending the Food and Health Bureau to issue compulsory testing notice. For the exemption, as the CE has mentioned, those who had been infected during the 5th wave, that is since the 31st of December last year, they will be exempted from testing during RTD or CDN because as they have been infected, their risk of reinfection within the first 3 months is minimal because they have recovered from infection and they have immunity, so they could be exempted from testing. But however, for inbound travelers, I think the testing requirement, the Food and Health Bureau will announce the details soon, and I have no information here.
Okay. We don't have any corona updates on the children's mortality, but I will summarize that within the fifth wave, there are 6 kids pass away due to COVID. The age range from 11 years old to 9 years old.
下一位呢位男士。
The next one, this gentleman, I'm from AM 730. First on CTN, you said that very soon CTNs will be issued in high-risk areas. Do you target buildings, just like what you did in January? You will not target workplaces or restaurants. And for contact tracing of close contacts, would you be just contacting or tracing the next level of close contacts? Or would you be looking at those who have been in contact with the patients 2 days prior? And then you would say they would collect information. What kind of information is that? And then designated clinics. You have launched the XJ Go for bookings. And in the second phase, has it started? And what is the utilization rate of designated clinics in recent days? There are suggestions online that people will go to designated clinics to get proof of recovery. Do you have the figures? Will these affect the patients? Third, genome test sequencing. Well, actually, some people who tested positive on RAT will do our PCR tests. And also, some companies have asked those who tested positive for RAT will have to do a PCR test and get the positive result. Would you be appealing to the companies so that they would also accept the RAT positive results as well, and that repeated tests do not have to be undertaken? And about CTN, the Food and Health Bureau said that they will resume CTN very soon. Well, in the initial stage, they will cover high-risk buildings. There are still a large number of cases in the community, so we'd like to focus on big estates, for example, residential blocks, and not individual restaurants per se. And currently, given the current level of infection numbers, many people have visited many restaurants in Hong Kong. So in the initial stage, we will target the high-risk groups and also buildings where a large number of cases are found. So this is information that we have ready on hand. As for tracing of close contacts, we adopt the approach of mainly of home isolation. Close contacts are mainly asked to be on home isolation mainly. We have so many cases now, so we focus our efforts on the close contacts of people who have contacts with the patients after they get infected. So they are mainly the household members of the patients. If the patient's living environment is not that desirable, then we will arrange for the patients to be isolated in isolation facility so that we can curb the spread of the virus in that building. Now, for those who do the PCR test after confirmed of contracting the virus, we do actually tests in 2 ways, PCR tests and RAT. Now, generally, if you test positive for RAT, well, they are readily accepted as confirmed cases, so you don't need to do another PCR test. And for members of the public who test positive for RAT, we would ask them to declare the same on our online platform, and then we'll consider as confirmed cases. We would verify the information. They have to upload the identity information and photo, and then we will issue an isolation order to them. So for confirmed patients, whether they test positive in PCR or RAT, they will receive an isolation order. That means they have to stay at home or wait for us to arrange to take them to the isolation facility. They should not go out. Now, if Hong Kong people test positive for RAT, they should not go out And for a PCR test, that is not needed. We also know that some members of the public may do an RAT and test positive, and on the day 6 and day 7, he has 2 negative tests in a row. Then he can go back to his normal life, and there is no need for him to do another PCR test, because the first PCR positive test is considered as a confirmed case already. Now, for the HA goal function, we are in the first stage, and this applies to people who have registered HA and are using HA services. The next phase has not yet come into operation. We would like to cover those who have not registered at HA or not using HA services as soon as possible. Well, for the 23 designated clinics, we have provided diagnosis services to 77,500 patients. I have not heard patients coming forth to get certification document from us. Our hotline will be providing the relevant advice to people. The journalist in striped at the back row. I'm from Hong Kong 01. The first question. The flight ban will be lifted on the 1st April. People should have 2 doses before they can board the flight. Will children be exempted? Because the vaccination rate in different countries differ. And then in previous press conferences, it was said that even if for people who have not declared their positive results can still get the exemption certificate for vaccine pass. But then the private doctors said that they have not received the latest guidelines from the DH, so they refused to issue the relevant certification. So will the DH issue such guidelines to private doctors for them to issue the exemption documents to the recovered patients? Thank you for your question. First, on flight ban and the resumption of flights. The FHB has issued a statement yesterday. The FHB is mapping out the details, and once these are ready, an announcement will be made. So I have nothing to add here. Second question about confirmed patients. Generally, if a person has been confirmed as a positive case, he or she will have to be abiding by the suggestions of the Joint Scientific Committee and the CE's Expert Advisory Panel's recommendation on vaccination. And if that person has a PCR positive test SMS or a hospital discharge record or isolation order issued by the CHP, or a doctor has certified that he has a PCR positive test result, or he has successfully declared his case in our RAT platform and got the isolation order. All these can serve to prove that he is a confirmed patient. And the CHP and the government have all along been providing online guidelines to private doctors, advising them on how to issue medical exemption certificates. And the content has been constantly updated, and believe that doctors will exercise their professional clinical judgment and take reference from our guidelines and issue the relic. And we noticed that earlier, some confirmed patients have tested positive on PCR test, but they have not been registered on the our system, and they have recovered. And they have never received an isolation order. The DH is well aware of this, and we feel sorry about this. And we would be sending an SMS to the relevant persons based on the information that we have received. And once the person receives this SMS, all they need to do is to go to the website and input their ID card number, and then they can get an isolation order. So this work is going on. And if members of the public have been confirmed and they have not yet received an isolation order, they will get the order in due course. So, and if members of the public have questions on isolation order, they can via the website ratb@dh.gov.hk.
I'm from Phoenix TV. From the 20th of March, we can see that the confirmed case numbers is always around 14,000, but then the drop has not been continuing. Why is that so? And for the makeshift hospital, Fangchang Hospital, will it sort of waste the resources there, because there might be some empty units that are still unoccupied? If it is not fully used, will the government think of changing its use? And also, Mr. Patrick Nip, when being interviewed, he mentioned that there are still about 10% of the elderly people living in care homes who have not been vaccinated because their family members have objected to their being vaccinated. And Mr. Nip said that there will be outreach teams going to these elderly homes to talk to the family members to convince them. First, let me talk about the community isolation facilities. They are taken care of by the Security Bureau. For Penny's Bay's facility, it is jointly manned by the DH and HA, and the occupancy rate is more than 50%. Well, I think that if there are less people living there or moving into there, that means that it is a good sign. That means the cases are dropping. Regarding the trend of the confirmed cases, yes, I agree that indeed the number has been quite stable. In the past few days, every day it's around about 14,000, 15,000 to 20,000 per day. I agree that this is lower than that of a week or 2 weeks ago. However, the decline is not continuing. So, but then it is still on a very high level, because it's about 15,000 per day. It's still a very high level. That means in Hong Kong, the new confirmed cases for every day is relatively high when you compare with that of the situation in other countries. So we should not let our guard down. We are still witnessing a very high level of confirmed cases. It is still a 5-digit situation per day. Of course, if we compared with the number of the peak, that is 60,000 to 70,000 per day. Of course, now we are having 15,000 per day. You can say that it has lowered. However, I must emphasize that this is still at a very high level. We should still be vigilant and also try to get vaccinated ASAP for those who have not been vaccinated. And we should all try our best to control the situation, hoping that the situation will ease very soon. For the vaccination among the elder people, the government pay a lot of attention to this, and we hope to boost the vaccination rate among the elderly people as soon as possible. All the scientific data shows that vaccination is a very effective method to reduce severe cases and deaths, especially among the elderly people. And there might be some myths in the community thinking that people or elderly people who have chronic diseases are not suitable to receive vaccination. These are not true. We hope that we hope to contact the family members of some elderly people who are still adamant that the elderly family members should not get vaccinated. So that's why we try to contact these people and try to convince them and try to talk to them. Next, please. Lady at the back. I'm from Now TV. Dr. Al mentioned that the declaration platform will be further enhanced. Will you consider the following? That is, the person has to upload the Leave Home Safe record so that you can enhance your contact tracing work. And you also mentioned that there are quite a lot of confirmed cases in the community. When CTN are issued, will you perhaps adjust the frequency of testing and to avoid people having to queue up for a long time to receive tests? And next, about the oral drugs. There are over 10,000 prescription of MSD and about 2,000 of Pfizer Paxlovid. Are there any side effects reported? And or are there cases that show that after the oral drugs, the situations of the patient have improved? And for those people who have and have not been vaccinated, will there be any difference in prescribing the oral drugs to them? Can you talk a bit more about the prescription guidelines, please? We do have two online platforms, and we encourage members of the public to report their positive cases, be they PCR or RAT positive results, to provide information to us through these platforms. We have this would enable us to gather the situation, and so that we would know about the personal details of these confirmed cases. For instance, the residential address, where they work. That would help our contact tracing work, and we will, through the information they provide, distribute the antiviral kits to them, or the anti-epidemic supplies back to them. This would also enable us to know how many family members they are living with, their residential situation, whether it is convenient or suitable for them to do isolation at home. All these information are very important to us, so that we can arrange for the make necessary arrangements for people to be moved to the community isolation center. When the case numbers drop, we will then have the capacity to issue more CTNs. Of course, for CTNs, it really has to depend on our PCR test capacity. If there are suddenly a lot of people who require to undergo PCR tests, it may be high risk, and also people may have to queue for a long time again. So we have to keep a close monitoring of the situation. Well, in issuing the CTNs, it has to depend on how many people will need to receive the notice, and also our testing capacity. Regarding the oral drugs for Molnupiravir, and this is mainly it is for people under 18 and for pregnant women. These are not suitable to receive this drug. For Paxlovid, it is not suitable for people who are suffering from renal diseases, and there might be some interactions with certain drugs. So depends on this. The HA has very detailed clinical guidelines, and we have set down all these guidelines and also briefed our frontline medical staff. And up to now, we have not received any reports of patients suffering from serious side effects after having these drugs. And for those patients who have been vaccinated and against those who have not been vaccinated, the situation, we don't have this situation at the moment.
Let's answer the last question. I'm from Commercial Radio. Good afternoon. You talk about a 55-year-old male who has passed away. You said that the CD value was 30 and he recovered. But how come that on the 21st of March he became unconscious? Was his cause of death related to COVID-19? And then for HAGO, the Hong Kong people can make appointments at 23 designated clinics. The quota each day is 1,000. But a lot of people said that the quotas are taken up very quickly. Professor David Hui said that patients should be taking the medicine within 3 days of symptom onset. So it's difficult for the patients to get the medicine at the initial stage. So while they're waiting, what can they do to help themselves? First, on the 55-year-old patient, as I said, he had some problems with his blood glucose level, and he had abdominal pain, shoulder pain, and that may be signs that he was suffering from pneumonia. And after admission to hospital, and his kidney function and blood glucose level had been stabilized, and he was transferred to the Liking Rehabilitation Building. And on the 15th, CD value 30, 18th March, he transferred to Liking, and on the 21st, he became unconscious and he passed away. So what I said is that I have doubts on whether his death is related to COVID. But for all these death cases, they will be passed to the experts for further analysis. And that takes time. So we will be making announcements later. As for designated clinics, the number is 23. And we are trying to add in more designated clinics all the time. And we would also like to increase the quotas of these clinics. And it's now over 77,000. We know that there is a keen demand. We will be keeping close tabs on the demand, and we would conduct review and enhance our booking system. And if the demand continues to rise, we will consider whether we should increase more quotas. Thank you very much. That's the end of the press conference. Thank you very much.